Assalamu alaikum, ladies and gentlemen. Good evening. This is Amber, your host, and I am with you today again with Channel 52 with a topic on effect of COVIDs on our lives and on our environment. It's been some time that I wasn't here, so I'm back with a panel of very useful guest members, and they're from all over the world. So I'm going to be introducing my first guest. He is Dr. Tawfiq Aziz, MBBS from Dhaka University, and he's joining us from Bangladesh, working as assistant professor in Department of Internal Medicine Specialist and medical students in Medical College of Women's. As well. And he's currently working on a COVID committee with COVID-19 with his team where he is. So thank you, Dr. Tawfiq, for
Thank you very much for inviting me today. Looking forward to participate with all the participants.
Okay, thank you. And our second participant is Dr. MUSHFIQUR RAHMAN, MBBS from Dhaka University. And he's attending a psychiatric medical director dual diagnosis unit, First Hospital Common Health System in Pennsylvania, PA. He's also a clinical assistant professor in psychiatry in Commonwealth in PA as well, and diplomat of psychiatry and neurology. So thank you, doctor, for joining us.
Thank you so much for inviting me. I really appreciate the opportunity.
Okay, no problem. The pleasure is mine. And the third person I have is another dear friend of mine, Maria Bell. She's an EPIC system analyst, and her background is MSc Biology, MBA Clinical Experience in Research and Biopsychology. And she wears a lot of hats, but today she's here as an EPIC. So thank you, Maria, for joining us.
No, thank you, Amber. I appreciate the invitation. Assalamu alaikum to everyone.
Okay. So I would want to start from Dr. Tawfiq, from you, because you are in Bangladesh, and we'll come back later about United States and our COVID numbers. So I want to hear from you, what are the situation in Bangladesh going on? And I know you are specifically in Dhaka, so what are the numbers, how's it's going? Because we don't know how much the accuracy of the numbers are.
The current number, the infected COVID-19 patients are almost 100,000 now. And this is mostly in the city based. So most of our rural areas are unaffected till now. Our infection rate is ranging from 20 to 22%, and mortality rate is 1.2 not to 3% at the moment. But the number is actually rising on a daily basis, so which is very alarming. And the experts in my country, they're predicting it will be on the higher side in a couple of next weeks. So we're a little bit worried. Most of the hospitals in Dhaka city and in another city called Chittagong are mostly occupied by COVID patients. Now, another problem is the non-COVID patients at the same time, because there are other patient groups here who are not suffering from COVID. So there is a problem going on between tackling COVID and non-COVID patients, because perhaps you know there are dedicated COVID hospitals in Dhaka and in few other cities, and there are COVID and non-COVID hospitals in some areas, where actually I'm working in a hospital where COVID and non-COVIDs are mixed. So some patients, they might not prefer to come to hospital, so we are using telemedicine at the moment. But yes, attention is going on.
Okay. So I know that in United States, because my husband works in Hackensack Medical Center, and I hear from him, and I'm actively involved in finding out. The numbers were so high that they had to change the cafeteria into COVID center. And the regular patients were not the priority at that time because New Jersey is the third highest number in the states. It still is. So that was one of the way that they tackled the numbers. And having said in Bangladesh, because it's where there will be other cases coming as well, so that makes it even more harder. So, Dr. MUSHFIQUR Rahman, I want to know from your point of view, because I know you're in psychiatry. So, but things are impacting throughout our environment due to COVID. There's so many things are happening. Where is your perspective come in this?
Well, I work in a psychiatric hospital in an inpatient setting. The number of the patient went low at the height of the infection pandemic. Things are getting better in terms of COVID-19 infection in Pennsylvania, but we can see that the higher rate of mental illness that has been exacerbated by the COVID-19, particularly the lockdown, not able to go out and see their therapist or psychiatrist, and also the increased tension and fear and worry that also impacted a lot of people. And we can see a lot of substance abuse as well, along with the mental health exacerbation. So the number of the patients are gradually increasing in the inpatient setting. Luckily, we have started telepsychiatry and telemedicine, and that is helping to some extent to this patient. But overall, in Pennsylvania, the COVID-19 is improving. We went to green, our county went to green yesterday, and things are getting better. And we were not as worse hit as New York or New Jersey.
Yeah, you're absolutely right. Numbers are looking better. Passaic County used to be the second highest. Now it's on number 4. And I just checked the numbers today. It looks better. We do still have a death rate of 1,529, but we do have a recovery rate of closer to 462. So there are coming on, as you said, and weather is changing. And depending on that, our mayor, because we are from Patterson, day before yesterday opened 2 more parks for the reason of because Father's Day is coming tomorrow, and the numbers looked good. When he tested the Patterson numbers, it was only 10 confirmed cases, which was encouraging to open parks at this time. Having said that, there are riots going on as well with social distancing, and people are not as careful. So it is expected that it's going to relapse, it's going to come back again. So what is your feedback on that?
You were talking, the question was towards me?
Yes.
Well, we have to, obviously, we have to be very careful about, particularly in falls, that it may come back. But for mental health perspective, we can take the opportunity now to get out and spend some time outside by maintaining social distancing and using masks when possible. You can see that in the big cities, because of the cramped, significant number of people infected and the lockdown, and then the big city also has large population living in apartments. For them, it was really disturbing and very difficult for them to be cramped in a small space for a longer period of time, and their anxiety and distress was much, much higher. So now that the opportunity is there, that it's becoming green and they can go out, we should take the opportunity to go out, but appropriately maintaining social distancing and being careful and aware of the risk of the infection.
Okay, well said. Maria, I'm going to come towards you because through your perspective, I know you are behind the scene working very diligently. You know the numbers and the importance of health insurance, how important it is for us to have a good plan or even have a plan.
Uh, I would yes, it is important to have a plan because this is essentially how the American medical system operates. Have options to within the medical system to help get you into a government plan if you do not go into a private insurer. So the purpose of having the insurance plan is to facilitate you getting care, to be able to control your costs, to know how much, predictable cost of what care will be responsible for. Uh, so part of the telemedicine has become now a very big part of providing wellness care, and it's really, I think, facilitated care because people are now more willing to spend the time on using technology. Uh, Depending on where a city or a region of the country is in the state of the infection cases, will determine the overall response of the general populace to accessing their insurance, to seeking care, to do this. So, like, generally, as we've seen, like at the health system where I work, the initial response of anxiety and worry, cause people to stop seeking care essentially at all.
Correct.
So it was through advertising, and continual using public means of communication to reassure people that insurances are accepted, that it's important for you to continue, your wellness care, to continue your mental health visits, to continue speaking to your provider if you're sick with chronic illness or if you suspect symptoms, really did work. The insurance billings, the hospital incomes actually remained pretty stable. So as here in New Jersey, as we're now on the downside, the significant downside of the infection cases, now people are beginning to access care like back in person. But the telemedicine visits and the trust in that particular type of delivery has really increased dramatically. People have become very comfortable in using platforms like Zoom,
Correct.
and the ability of a physician to actually look at you through a screen and to see you as though he were actually seeing you in the office.
Yes, there's
You're
good
not
and
on a
bad.
video game. You're not on a TV show. This
Correct.
is you really talking to your doctor as if you would in person. So people are trusting the privacy, that they can say what they wish. And that's especially important for continuing behavioral health therapy and judging effectiveness of medications. So as Dr. MUSHFIQUR can speak to you a little more.
Well, that's good to hear from your perspective because and it's almost been 3 months that people are going through, and there's, as you said, that there's a trust has been built in telemedicine because there's no other option. At the same time, human being is an animal of practice that we don't have the luxury. You're not going to be seeing a doctor. That's the only option you have. Whereas, well, in Dr. Tawfiq, I'm going to come towards you in Bangladesh. Is there an option of telemedicine, or it's a complete different environment there?
Right. This is really surprising that to some extent, the region of this side of the world, in this subcontinent like Bangladesh, India, Pakistan, I think technically we are more advanced than the Western country. This is really surprising. Actually, we have started doing telemedicine and all other, app-based teleconferencing like Zoom, Skype, and there are lots. From the very beginning of the COVID, what we did in my hospital, we have started telemedicine right from the beginning of this COVID attack, so that we don't have to come in contact with patients. And why did this happen? Because the personal protective equipments were very expensive when they first came into Bangladesh, and we actually could not afford for everyone. So what we made a plan, so let's begin with all this digital thing. Let's go to digital so that we don't have to come in contact with the patients. So we opened up a couple of telemedicine corner in my hospital where doctors actually go and sit there and patients can access them through telemedicine. As Maria was saying, so patients were really comfortable by seeing their face that, yes, we are actually working in hospital. So they got relieved. And having said that, not only in hospital, there are thousands of free telemedicine services going on all over the Bangladesh. In villages, in cities, in major cities, from different organizations, they're providing free telemedicine services for COVID patients, for non-COVID patients. Even for the COVID patients, there are a few groups who are actually helping them how to monitor the oxygen saturation level. And they're advising them to buy, the pulse oximetry, oxygen for home use. And they're actually overseeing them through telemedicine. So this is really brilliant.
That's amazing, and that's actually it is very. It's to be very proud. And actually, I had an interview with one of my special need episodes, and the chairperson of Punjab University from Pakistan. She have created YouTube channel for special need kids that they do the telemedicine and therapy, PTOTDI, over over the internet. And not only that, and the parents are using for special need kids, for mute kids, for deaf and blind as well. So I do have to accept that us being in superpower country, we have been behind.
That's true. Yes, it is true, actually. Yes,
that is true. So heads off to you guys for that. At the same time, it is true that you don't feel that satisfaction of seeing a doctor in person. But my question to you, I know because you are in the COVID team, do you guys did testing, or how was the testing? Is the testing facilities available in Bangladesh?
Right, testing facilities are not, I would say, very accessible for all of the patients, because we are expecting to do 20,000 tests per day, but now we have reached up to 15,000 tests per day till yesterday. But the queues look like it's more than 100,000 all over the Bangladesh. So in that case, we are far behind tracing them. So in that case, we cannot test each and every single person. So it's on priority basis, and government is providing free tests. In some of the private centers, government has fixed a charge where actually people can go and they can actually pay upfront and get the test done. But this is very restricted. In 4 or 5 centers, they can actually do it privately. Otherwise, they have to go to the government fixed test centers, and they can get it done. But we are far behind the numbers.
So how much, if somebody has to pay out of pocket, how much is the test?
In Bangladesh, in Bangladeshi currency, it is 4,500 taka. So I guess it would be around $80, $70 to $80. No, maybe less than that, $50.
$50. Very similar. When we started here in Passaic County testing, it's free right now. The government is doing free. Even they're offering for people who don't have papers, and they open it in the schools as well, 7 days, Monday to Sunday as well. We all try to volunteer there. and we did two ways. We did nasal and oral. So the numbers has gone significantly down. So the next perspective that I want to bring with COVID is the environmental impact of it, because we have lost, many people have lost many family members. The United States numbers is 221,000, and the death rate is 119,000. So we lost almost more than the First and Second World War with this COVID. And it has brought psychological impact on people. We never had this much psychological issues before, or people using. I am part of a Montclair State University, where we are using in our department of autism. The psychology department is offering free counseling, and people are not using it. So that was very surprising to our professors. Only the people who are calling is maybe the people who knows daycare providers or doctors' offices. These are free counseling, and nobody has called as of yet, unless the hot call numbers are. So I want to know, Dr. MUSHFIQUR Rahman, what is your feedback on that?
I think that there is a lack of awareness about the availability of the service in the community. The psychological toll is huge, and multiple study has come out suggesting that there would be increased number of mentally ill patients in North America, particularly after the number of people died from it, and also the fear and the financial impact of it. But a lot of, particularly in our community, the awareness about mental health is not as much as the Western communities. And that's one of the reasons. And another reason is that people are not aware that where are the services. There is another problem because our health system is insurance based. So a lot of people doesn't know whether they have to pay for their services they're seeking out. So that's, I think, another reason that could possibly cause that not seeking out help for mental health.
And you're absolutely right, which leads us to Maria. I wanted to ask you, so if somebody don't have a health insurance, what would be the best way for them to, I know when people get sick, that's the time that they apply. I was trying to help one of my clients the other day, and I was having that conversation with you. The gentleman is already retired. He's 85. So there's 15 years. Now because he's sick and he's not feeling well, we are applying for his health insurance. So he has to pay the penalty for 15 years. Having said that, go ahead.
Okay, that is, like as we were discussing in that particular case, that was an elderly gentleman looking for the Medicare insurance. So that's a government-sponsored program that begins at typically at age 65 for retirees. The general route is if someone comes into a clinic or hospital for care and says, I have no health insurance, I am an uninsured person, that person is directed to the office manager who provides them the name and a contact time, like an actual appointment date, with a financial counselor in the health system. So, with the particular hospital system I work with, there's an entire department dedicated to this, to processing people who, need access to government sponsorship. So there's, it's a very well-formed pathway. So there will be, the request for documentation, the request for verification of income, and, like the person's current legal status, the country, resident, citizen, etc. So it's a rare case that someone is denied.
Okay.
So the other option, if a person, does not want to actually end up applying for healthcare, but would prefer to work on a cash basis, There are plans, like a hospital or a healthcare clinic will actually set you up on a payment plan. And then there are private options, which are termed as membership clubs, which you purchase a piece of, and then you pay in cash for service, but you get it at greatly reduced price because of the bulk buying power of the club.
Got it. And I
So
know
that's used for like services that medical insurance often doesn't cover, such as eyeglasses or cosmetics for dentistry.
dental, yes.
Yeah.
And I work as well. And I know in Bangladesh there is no luxury, or even Pakistan or India, of having health insurance coverage. Is that true, or are they changing a little?
No, we don't have any health insurance in Bangladesh. In government hospitals, they have to pay a very little amount, but in private sectors, like in my hospital, they have to pay for each and every single service.
Yeah, before you get seen, you have to pay, otherwise you won't be seen.
Yes,
Okay.
correct.
Yeah. So now I want to switch to the issue of suicide, as we have been seeing it is on rise. I'm specifically talking about things happening all around the world. The first thing which happened in North America, the German, we had the high propensity suicide rate because the minister in Germany, he committed suicide. That was in early March. In Manhattan emergency room, the physician, she committed suicide in April. And then, so there's one person is committing suicide every 40 seconds. That was the data which was collected September of last year. Now the data has increased way more. They're still saying every 40 seconds there is somebody committing suicide. Very recently, we had a Bollywood actor. His name was Sushant Singh. He died last week. And from that day till today, because I was looking, there are 3 deaths linked to him because his followers, one girl, which is 14 years old, she committed suicide because she couldn't handle the way he passed away. One of the teacher of the high school, 21-year-old, he committed suicide, linked to the same thing, the actor. And another 15-year-old girl committed suicide. Parents didn't know, they're in their room. So I was trying to see, later on when the question was asked with the parents and family, what was going on? So there are signs and signals which families, parents, friends, we are missing. All of a sudden, the person who is impacted by that depression or stress or stop talking, not eating, not doing well, but there's something missing. What is that which I want to know from each and every one of you, but I want to go first to Dr. MUSHFIQUR on that. What are the signs and signals? Suicide, I know it's a bigger thing, that there's depression, anxiety. How can we help? How can we really do something before it actually impacts? And it's in rise, and it's increasing, it's coming. As we know, domestic violence, social abuse, child abuse, senior abuse, everything is on rise. But beside that, what are the signs and signals, and what can we do?
Well, first of all, we need to improve the awareness about mental health, that it's a real problem. You know that with mental health, there is a lot of stigma attached to it. We can accept a diagnosis of hypertension or cardiac disease or gastrointestinal disease, but accepting a mental health has been a problem for particularly our community, like South Asian community. And even for a Western country, there is a lot of stigma related to mental health. So there is a lot of hush-hush, not seeking out help in terms of mental health. Now, there are significant signs that can be easily detected, like a person's functionality gradually get impaired because of depression or anxiety. you can see that there could be irritability increase. The patient is being edgy, on edge all the time, being snappy towards family member. If he is a worker, there would be a impairment of their professional life. If someone is a husband and wife, and they would have difficulty in their personal life. If it is a student, you can see that their education, their grade has been deteriorating. So those are the signs that you can pick up. Besides that the patient often says things that I am not feeling well, I feel overwhelmed and anxious. A lot of the time we don't pay attention to those kind of things. And as parents, family member, friends, it's very important with these current circumstances, with the pandemic and the stress, we should pay attention to that. That's number one. Number two, that a lot of the time we don't to seek out help because we feel ashamed of having all these symptoms of anxiety, depression, PTSD, even postpartum depression. It has been very common even in our community as well. And a lot of the time we go through it without realizing that we are suffering. And its treatment is very easy and simple. And even a little bit of medication and therapy can significantly improve the outcome of this illness. So I think in a nutshell that awareness, educating the community, and this kind of webinar that we are doing now is very helpful for the whole community.
You're absolutely right. There's a stigma and there's a taboo to it. I myself experienced postpartum depression. I had 3 kids. In each pregnancy, it went, worse. The first one was only baby blues, lasted for 2 weeks, and it went because mom was there. And the next 2 pregnancy it got, and by the 3rd one, I recognized it more. And you're absolutely right. Took medication. I was on medication for 8 months, and it helped me because it's extremely important, right state of mind to take care of kids. Exactly. Otherwise, if you're not in the right state of mind, you won't. And I'm an advocate about it, and it's extremely important. The other thing is that many people saying that this generation, which is our generation, or our previous parents, says that in our time people didn't have all those problems. This is this generational problems, and each generation going on is going to have more of it. So how much truth in that?
Well, it's very difficult to go back and scratch the surface of their generation to look into what was happening there. But I think that if we talk about our subcontinent, we used to have joint families. We used to have relatives that were involved, and then we used to have a lot of ways to express ourselves because of surrounded by a lot of friends and family. As the society is becoming more, or families are becoming more and more nuclear and isolated because of the urbanization, industrialization, that also may have an impact on the way we are feeling now, and the stress and anxiety is a little higher. It could be, I'm not sure. I mean, we have to do a proper study to look into it, and it's very difficult to go back in time and do it. But that could be an explanation. But overall, at that time, and even for now, this time in our community, the awareness is not there. And if you properly scratch, and you can see how much mental health problem is there. And I can tell you, being a psychiatrist here, I have gotten so many phone calls from friends and families, and I have counseled them over the phone and asked them to seek help. And that says that it's still there, and probably it was there, and it needs to be addressed urgently.
Awesome. So, Dr. Tawfiq, I would ask you that I know that in Bangladesh, things are different. We are dealing with the more bigger problems. But having said that, you are internal med. So when you see this, and you must have seen this in RISE, do you think it's more important to take care of physical needs at that time, or the mental health needs to be taken care of then and there?
The thing is, I'm not a psychiatric or psychological expert, but I think the problem in Bangladesh is lesser than in comparison to the Western part, because as Dr. Mushfiqur Rahman was saying, we are used to stay with I am used to stay with my parents. So there are actually lots of friends and families around. So I think the mental illness is a bit on the lower side in Bangladesh, even though I'm not expert. But having said that, I'm working in internal medicine. So most of the mental illness we tend to see in internal medicine is from the elderly groups, because they're not taken care of. Their diabetes, their hypertension, their ongoing medical conditions are not well managed, difficult to buy meds, because most of the economic activities are still, in some places are shut down, in some parts still it's locked down. So these group of people, the elderly people, they're actually suffering from, to some extent, mental illness, and we have to deal with that. But as you were saying, physical illness in Bangladesh is, I think, more important than mental illness for patients, for our patients.
Mentioned about the data. I have collected a data from World Health Organization, and it says the suicide rate is higher in the age of between 15 to 29. That's overall throughout. This is throughout the world, and then they have. If I could share that with you, I would have loved to share it, but we're not doing the Zoom, so take my words on that. And then it says between male and female, the data is collected. It's more male who commit suicide, and surprisingly, the highest country is Europe, who's committing suicide in the numbers, and South Asians, and the lowest one is Eastern Middle East, which was very surprising to me because we do hear about the Shaheed bombing, and I thought that maybe because it's considered not even suicide to them, it would be higher. So South Asians are the second. It's on 15%, and again, men is higher. So women are lower on the. Maybe women become the cause of men to commit suicide. Beside the joke. So I'm coming back to Maria, because I see many health insurances do not cover mental health piece. Because when I myself worked in Catholic Charities and I was the service coordinator, we were not given health insurance for mental health piece.
I think that health insurance has changed over the years, and the focus on mental health is increasing. Remember that the purpose of an insurance plan is, even though, how do I say this? Even though insurance plans are viewed as like a safety net for you, because you pay premiums, you are building, I think, an amount of equity, like into this policy. The purpose of insurance plan is to provide a predictability of cost of medical care for you to access. So the initial purpose of insurance plan was to cover physical medical expenses. Initially it was only high cost, things like operation and extended hospitalization. It gradually started covering wellness services, and insurance companies now are increasingly paying for mental health. The traditional psychotherapy, where you're just simply sitting down and talking with a counselor one-on-one, is probably the most widely covered.
Mm-hmm.
You have insurance companies that are now like offering payment to people who were for a long time viewed as like borderline medical, not medical. So they weren't included in plans. So if you have, licensed counseling through social workers, if you have family therapy, these are now recognized as fully licensed and payable practitioners. So the push to get people like into counseling is still partly there, partly not. It's typically driven by a relationship between a healthcare provider and the patient to refer the patient into counseling or to push them, because this is strictly a voluntary relationship that a person's willing to undergo.
Correct. Absolutely right. Absolutely. Yeah.
So it's generally would need to be, something that the patient is complaining, and then the family physician, leading to, I don't know, there. I think you would benefit talking out with someone.
So it's like Dr. Tawfiq would see a patient and he thinks that, okay, I see the patient, I give you insulin and I give you recommendation, but I see some psychiatric issue and I believe that you should go see Dr. MUSHFIQUR RAHMAN. So that's the link, correct?
Yes, that is the typical link. A patient, if someone self-recognizes symptoms, to say like, I've had a very traumatic event, like my husband has just died, or, my parents, now both have cancer and I have no siblings to help me take care of them. People will self-recognize like the need for counseling and can seek out like these people quickly, but it is not the typical. Most of it is like, some kind of a gentle push or a nudge, to get someone to follow through.
Correct. Dr. Tawfiq, you wanted to say something?
No, I wanted to say the same thing, but sometimes being a clinician, we can actually pick up the sign symptoms of mental illness, and we actually try by ourselves to find out what may be the reason for anxiety or depression, because as we were discussing earlier, a patient in Bangladesh has to buy the service. So they might not actually visit a psychiatrist and pay them again. So in that case, we have to find out whether it's a case of major depression. Is there any sign symptoms of suicidal tendency or not? So in that's a red sign. So we have to intervene in those cases. Yeah, so that's what I wanted to say. So to some extent, being an internal medicine physician, we try to deal with some of our patients.
Okay.
Can I just say a little bit about this, if you don't mind?
Sure.
So there are very simple screening questions that a primary care physician or a family medicine specialist can do to recognize the underlying mental illness. It could be depression, it could be anxiety, even could be postpartum depression, or even dementia for elderly people. I just wanted to add one more thing, that because of this pandemic, it has taken a toll on the healthcare professional. And I know many of my friends in Bangladesh who have been contracted COVID-19. Some of their family member has suffered death because of COVID-19. There was a study done in China at the height of their COVID-19. And the study was done kind of a survey on 1,257 people. Almost 50% of the healthcare professional, which includes nurses, physicians, and healthcare tech, suffered from depression or depressive symptoms. 45% suffered from anxiety and worry, and 33% suffered from insomnia. So with the current circumstances that going on in Bangladesh, and a lot of physicians are getting infected and dying, I think their mental health is also at jeopardy at this point, and it needs to be addressed. I mean, even to talk to their friends, talk to their families, and needed seeking out specialist help would be very helpful.
Yeah, because as I said earlier, you need a healthier mind to take care of anyone. If you're not going to be able to take care of yourself, you would not be able to take care of other people. I consider our mind is the main computer taking care of the whole body.
Exactly.
So we have a question from our audience. It's saying, what advice do you have for people afraid to go out and resume their lives? So I would take everyone from all three of you. Dr. Mufti Rahman, you go first.
Well, it's very simple. We follow the CDC guideline or the guideline of the state in order to resume our normal life. If they are asking us to maintain social distancing, we should do that. We should be very cautious, particularly when the fall is coming and there could be a second wave of coronavirus. So do exactly what we were doing, follow the guideline of the state and the CDC, and I think that would keep you safe from contracting coronavirus.
Okay. Maria?
For myself, what I would advise is to make entry back into society in small steps. If the person did not say specifically, why that they are afraid, but assuming that it is, contracting the disease after having isolated and remained healthy, make your segregate, your entry back into society in small steps. Gain comfortability, wearing a mask, wearing gloves, being able to carry hand sanitizer, know where to go to wash your hands, be able to locate, what you consider to be, some safe spaces, and make small daily ventures. Go to the library, return your books, drop in the store, be able to learn how to stand in line at a larger store where people are queuing to go inside. How do I maintain 6 feet from someone? How do I maintain that walk rules? And taking the small steps. Go back to bring one day at a time. Bring some Clorox wipes. Don't be afraid to wipe the cart down. And just maintain your level of comfortability, as you get back into daily routine. And just watch people around you. If you see people who are obviously sick, wish them well, and avoid them. And do some personal health routines that help you feel like you are maintaining your health. If it's taking some extra vitamin C or supplements, eating some extra protein, going to bed a little earlier and getting sleep. The things that, make you feel like you're doing your part, as part of society, as well as taking care of yourself.
I actually appreciate, Maria, that you have given three very major points here, which might look very small, but they are major. That it's like go do one thing at a time, take one day at a time, and your level of comfortable and uncomfortableness. So go with that flow. What makes you feel better? Do slowly doing smaller things, going to the library and taking it, making it bigger according to that would help you actually. And then sleep part is extremely important. There's a lot of people that are having sleep problem, which is again linked with anxiety and depression and worries and not having a job, and with the situation, what's going to happen, kids not going back to school. So Dr. Tawfiq, from you.
From my point of view, in Bangladesh, the number is still on rise. So I would rather say don't go out of your home, or go to restricted places, follow your government rules and regulations, look for the red, yellow and green zone, and make your plan accordingly. Don't rush yourself. As Maria was saying, step by step, we should move according to the government rules and regulations. It's a very difficult situation going on in Bangladesh at the moment.
Yes, it is, and actually in Pakistan and India as well. And I was reading letters from the students, because now it's a final time for students, which is final year here too. But luckily, our kids are promoting to next year. Like my son graduated 8th grade and he's going to high school. But I got the news in Pakistan, and I was not able to get from Bangladesh yet. But they are not promoting students to next year without the testing. And I know, Dr. Tawfiq, you're a teacher as well. You teach in medical school. That's another anxiety for anybody, for even medical students. You know, it's like I have seen it becomes like a matter of life and death. If my whole year is gone, what's going to happen? So what's happening
Yes.
with that?
They have just missed one of their university professional exam in the last month, in the May, and since I'm in teaching profession, they tend to text me. Some of them call me. What is going to happen to us? But government has not decided anything yet. What is going to happen to not only the medical students but all students under Dhaka University or any other major universities? In some of the private universities, government have allowed them to take online exams, but not for the public universities. So this is still unknown what is going to happen to them. But surely I can see they have already lost one of their term, and I think it is going to be a year loss, 1 year loss.
Yes, that's what I heard in most of the South Asian countries, that students, no matter where they are, they're losing 1 year.
Yeah.
I don't want to say anything ahead of time. It doesn't look like it's happening here. Finger crossed for our kids here. Actually, most of the nursing students and residency students, they were given early graduation so they can get on time and start working right away, so it was a better opportunity for them. I do want to come back on that point because of the data. It says that the age limit between 15 to 29 is the highest number. Even the data is in front of me. The World Health Organization, it's the global one. Same age between 15 to 29 years. It is both male and female commit suicide between that age. What is the reason? It's a beautiful time of life, but what's going on of that age group to, what do you guys think?
Should I go first?
Please.
I mean, I don't know exactly study or during that study what was the cause they find out, but I can give you just a perspective. Usually the female makes more attempt, but the male are more successful to commit suicide, unfortunately. And I can tell you about United States because the easy access of gun and substances which make people more disinhibited to carry out their attempt is one of the highest cause of death of young people in United States. Also, easily accessible guns and easily accessible means to carry out suicide, and that's, I think, one of the reason of high suicide rate here in United States among those age range.
And substance abuse as well.
Substance abuse as well.
Yeah. Okay. Dr. Tawfiq, Maria, whoever want to go ahead.
I guess I can go.
I'm not an expert in this field, so I don't have much data, but I think so far I have read the newspapers and watching the television news and etc. I think suicides and this self-harm, all these kind of issues are actually on the lower side in Bangladesh for the last few months. And some of the experts, I was reading an article, he was very optimistic. Probably COVID has saved many lives. I'm not sure about this.
COVID have saved many lives in Bangladesh?
Yes, in terms of self-harm.
Oh, in terms of self-harm. So it's both. It's a way how you look at things. There's a blessing in disguise as well. People who are not able to spend much time with their kids and families, they were able to spend more time I'm going to speak from my own experience. We're always busy in Western world, and the way our setup of life is that I would work those times when my husband is not there, and my husband would work. So somebody's always there with the kids, and we were not able to spend time with each other as much. And he works on the weekends, but with the quarantining, we were able to spend more time and learn more about the kids. At the same time, this became a cause of domestic violence and abuse rise. It was at 6% in March. We thought it would be not as much, but it got higher than 12% because you are stuck with the abuser in the house.
Exactly.
So
Go ahead.
Go ahead, Maria.
I think one of the things I would add to this is when you're looking at people in this age frame, this is a prime time period, especially for, younger people in the West, for like self reinvention, exploring the world, questioning your values. What do I believe? Who do I want to become? What do I want to be? What do I want to study? So it's really easy for people in this age frame to kind of like lose their moorings, to really feel lost. So, a more traditional society that doesn't focus on always, what's the latest, what's new, what's greatest, what's cool, what's bad, may have less in the way of self-harm because there's an expectation of like a normative behavior. And one of the things I think has been increasingly so, like that you'll see in Western culture, is this push for like individualization almost to the point of extreme. Some groups will the norms of gender, the norms of nuclear family versus whatever it is that you want.
Yeah.
So
Interesting to hear
it does have an impact. So if you look at a family that hasn't been involved in each other's lives, say, I'm just generalizing here, but if you look at, it would, let me say it this way, it would be a very interesting study to look at these people who have self-harmed, to see how many of them have grown up with disconnected family structure, a dysfunctional family structure, grown up, essentially, in daycare, go to school, go to university, you're always, with rotating authority figure and things like that.
It's so interesting hearing from you the perspective this way. Dr. Mustafa Rahman, you were saying something. Please continue.
Well, there is a significant connection of trauma with their behavior that they provide in their adolescence. And I work in an inpatient setting, so I see more acute patients, the patients who are very sick. And we have seen that their behavior is directly correlated with the trauma that they suffered. So someone who has been sexually or physically abused, they themselves become the abuser. And then also they carry this significant depression, behavioral problem, some sort of personality problem. And that also relates to the self-harming behavior and suicidal activity. I think that has something. And the upbringing, there is some sort of broken family. The patient is raised by single mother or single father. And the area, the Appalachian train, where I work, the substance abuse has caused significant death of a lot of parents, that these kids are being raised by either grandparents or adopted parents. And that also, the system is not working there. And that producing more and more kids who are traumatized in their early childhood and during their adolescence. And that also has an impact of the number of people killing themselves in that age range as well.
And that's true. Like just ACEs, the impact on in young age that you have of trauma, it will impact you later in life.
Throughout the life.
Yeah,
Exactly.
it stays with you. But with the right therapy and time, it does help out. And the most important thing for us, as you all said, the recognition of it, that the problem exists. I remember, because I am myself as a graduate from DHAKA University, and during our internship hours, one of my student was going for therapy, and it was like that, oh, don't tell anyone, because although we are students of psychology, but we still don't want anybody to know that, oh, somebody's receiving therapy. It's taboo. So and then that's just the reason I'm giving that example is being a student of that department, understanding it. Still there is a stigma within ourselves that, oh, we should not be saying this. So we need to change that. We do need to change that. And it only starts with you, with your own self. We cannot expect that from others. We have to start and take step in that. And just by having programs like that, I'm wishing and I'm hoping that, I'm bringing more awareness to, to our public, and bringing a more idea of that, it's just like any other disease. It's just like I'm having a heart attack, just like Dr. Tawfiq and you were saying, if I'm diabetic, I'm going to a doctor and I'm saying openly, it's the same thing. We have to start talking about it openly. Only then it's going to become normalized that it's a need and we need to take care of it. I see another question here. Young people see a lack of leadership and not good coordinating between organizations. So I think that's a comment. That's not a question. But being that on a rise, it is worrisome. I do want to give a hotline number for suicide, and it is actually nationwide. If you Google, it's a nation suicide prevention lifeline number. It's 1-800-273-5255. And the good part about this is that you can chat on it. If you call, you have an option to call. You can even chat on it and somebody will respond back to you right away. And there's a website also on it. So there is help there, way more than ever before, because people are recognizing it. And especially with COVID, there's so many hotlines, and they're hotline in different languages. I myself is on the COVID hotline. It's in Bangla, it's in Arabic, it's in Urdu, Farsi, any different language. So please do not feel ashamed of the situation. I know we are coming closer to our time. I want to take last messages from all of you guys, and you can speak in any language to, give that message. I'm going to give it in 2 different languages. So I want to hear last messages from you guys to your audience.
So shall I speak first?
Go ahead.
Yes. সবাই সাবধানে থাকবেন। আপনাদের যেখানে আছেন সেই এলাকার নিউজ ফলো করেন, দেখেন আপনি গ্রিন জোনে আছেন না রেড না ইয়েলো জোনে আছেন, সেই অনুযায়ী সামাজিক দূরত্ব বজায় রাখবেন, ফেস মাস্ক ব্যবহার করবেন, সাবধানে থাকবেন। সবাইকে ধন্যবাদ। আসসালামু আলাইকুম।
Go ahead, Maria. You can go next. Dr. Mustafi, you can go ahead.
I'll let Maria to speak first.
Okay, thank you. Mine will be in English only. What I'd like to say is that this time period, during the quarantine lockdown, has been a time, that's kind of unexpectedly thrust on all of us. And it's been a time period of some intense reflection. It's very difficult, on people when you're used to involving yourself in a lot of external activity, which end up being distractions sometimes from the self-growth that you need. So this time period, can be uncomfortable, largely because now you're sitting here introspecting when you're not used to doing that. So, this, may need some outside guidance, for you to make best use of. So, as you follow the guidelines, for social distancing and masking and paying attention to what are, the requests around you, as you interact socially. Pay attention to yourself with this. Get the guidance that you need. Continue self-introspecting, journaling, recording your dreams, doing whatever, is going to help you, like not look back at this as a time period of like imposition, but as a time period where you got something like really good from it.
Awesome.
আমার পরামর্শ আমার ফ্রেন্ড এন্ড ফ্যামিলির জন্য যে সবাই সাবধানে থাকবেন, সোশ্যাল ডিস্টেন্সিং মেনটেন করবেন। It's not yet over. The COVID-19 is still very much there, and we have to be very careful. In regards to mental health, I just wanted to say one thing, that there is real help available, and many of the county in United States provide free mental health service. So even if you don't have any health insurance, you can always seek out community mental health services, so which is free, and you can do that. And also আমার friends and family যারা বাংলাদেশে আছে, যারা physician, যারা actively fight করছেন করোনা ভাইরাস, তাদের জন্য আমার পরামর্শ হচ্ছে, please talk to your friends and families about your personal health, about your well-being. It's very important because you are taking the burnout from the working long hours and things like that. So that's my request for my friends and family back home in Bangladesh. Thank you.
Thank you so much, guys. I really personally thank all of you to spend this time with me. And each and every one, you have given your own perspective in a beautiful way. Maria, I really appreciate you coming with us. Dr. Tawfiq, Dr. MUSHFIQUR RAHMAN. My message to my audience is that, as Maria said, it's the time of self-reflection. And I think coronavirus and quarantining has brought one good thing, that we start taking time in doing things. Before we were in such a fast pace, let's go eating, cooking, running, and kids, school, job. We never had time. With coronavirus, we were bound to take time, come home, taking our clothes off, shoes off, with everything, even with the shopping, with social distancing. This thing has taught us to take time and actually care for your family. What is really important at the end of the day, it takes a second for stop breathing. This has brought the necessity of life to simplicity. Is nothing actually matters in life. The most important thing is you recognizing yourself. And if something is bothering, please talk to each other. Talk to anyone. If you don't have family, friend, or anything, things happen. People commit suicide or go through depression is at the end that they don't have anyone to talk to, and it's painful. আমার মেসেজ আপনাদের সবাইকে এটা, যে আপনারা নিজেকে একা মনে করবেন না, প্লিজ। লাইফটা অনেক সুন্দর, and things can happen at difficult times, but please take time for yourself. And the message of love, the message of bhalobasha, that we are here for each other. Please, nijer jotno niyen. Life is precious. It's not going to come back. आप सब अपना ख्याल रखें, और ये जिंदगी एक दफा ही मिलती है, और हमें ही अपना ख्याल रखना है. We have to take care of ourselves. So with this final message, I thank all my audience and everyone. Please do not feel that you guys are alone. Even if you are physically alone, there are 1-800 numbers. Take advantage of it. Do not make that mistake of killing yourself. It's not worth it. So with that, thank you so much for joining. Allah Hafiz.
Allah Hafiz. Thank you.
Allah Hafiz.
So,
Bye, guys. I think the live is